we're going to talk a little bit about preventing, detecting, and reversing heart disease in a way that is a little different than I learned in medical school and training years ago, and has proven to be very helpful with my patients, my own health, I think. And certainly what I learned and what is taught is when we're children, we are born with perfectly clean arteries. There's 50,000 miles, maybe 20,000 kilometers of arteries through the body. They're perfectly clean, undamaged, but even by the time we're teenagers, playing after school, we start to develop some signs that humans are very prone to develop disease of their arteries or atherosclerosis. And by the time we're in our 30s and 40s, it becomes very common to even have occasionally clinically important lesions or plaques, but certainly by our 50s, 60s, and 70s, it advances to become the #1 killer of men and women throughout the world. And I'm sure the statistic is very close in India. If it's not #1, it's very close to #1 killer of men and women
very
throughout
close
India.
To #1, very close to #1 in India also.
Yeah. This slide is of very interest historically to me. And it makes the point again, this is a disease that starts early in life and progresses so slowly and silently, but we can prevent it and we can detect it. The bars that are the tallest all the way over to the left are soldiers from the United States that fought in the Korean War. So that would be in the 1950s. And these were unfortunately soldiers that died and had autopsies, but they didn't die of heart attacks. They died of gunshots and explosions. And the tall bar shows that 75% of them, despite being 21 years old, 24 years old, 25 years old, had plaque in their heart arteries. And the smaller bar shows about 18 to 20%. They were actually already fairly severe lesions in their arteries. Now, the middle group is the Vietnam War in the 1960s, and all the way to the right is the Iraqi conflict that the United States was involved with about 15 years ago. And it's good news that the amount of atherosclerosis seems to be decreasing, even in young people. It may be there's less smokers in young people, which is the statistics. It may be there's a bit less what are called trans fats in the diet, which is a good thing that's happened. And maybe there's better blood pressure and cholesterol medicine for some young people. But we've got a long way to go because this disease starts and affects almost all of us and at a very young age. Again, as I said, in the United States now for over 100 years, heart disease has been the #1 cause of death, followed by cancer, followed by lung disease like emphysema. And we have not made a significant, advance on causing heart disease to become a rare cause of death. It's simply not the case. And sadly, very often it's a cause of death in people that are in their 40s, 50s, 60s, and 70s. But I don't want it to happen in people in their 80s or 90s either. One of the major breakthroughs in this idea of what causes us to die was this analysis in around 2000, where if you look in the green bars, once again, we see what causes death, at least in the United States: heart disease, cancer, stroke, and chronic lung disease like emphysema. But what these researchers looked at in the orange bars was what was the actual cause of death. What causes heart disease, cancer, and lung disease? And by far, 85% of all these deaths were due to 3 findings. Do you smoke cigarettes or not? Do you eat a poor quality, meat-heavy, fat-heavy diet or not? And do you have physical activity in your life, or are you sedentary? And this suggested we might be able to control up to 85% of heart cancer and lung deaths by public education about don't smoke, eat fruits and vegetables, and be physically active. And we've been at that all over the world, of course, for decades, trying to educate people. But it makes the point that it is lifestyle more than genetics, far more than genetics, that seems to determine ultimately our health. And we all know this when we reach for a cigarette or reach for fried food, it's probably not going to move our health forward. And when we eat, a fresh, clean meal, a big, large salad, and we go out for a walk, we are advancing our health and preventing disease. So this is a classic slide that makes the point, in the medical system, where we're very good at mopping the floor. The example would be people have a heart attack. And I trained for years and practiced for years treating their heart attack with stents and angioplasty balloons. It was wonderful emergency care of a very sick patient. But if you don't turn off the faucet, we're going to just keep doing this and doing this and doing this. And the faucet is smoking, and the faucet is inactivity, and the faucet is poor quality and processed diets. And that's why we have to focus on the root cause, the real fundamental cause of these, killing diseases and diseases that rob us of quality of life. So it has been estimated from a number of studies that 85% of heart disease, 90% of type 2 or adult diabetes, and 60%, some would say even more, of cancer is largely related to our choice of food, our choice of fitness, and our choice of smoking or not smoking. There are factors beyond that. More and more we're learning air pollution is a major factor, water quality, toxins in the environment, genetics, of course. Sleep medicine is becoming a big, important role. And you asked me what time I wake up, so you're tuned in to good sleep. And chronic infections can be part of this, but it still boils down that the biggest part are easily controllable factors to avoid the diseases that cost hundreds of billions of dollars to treat, but more importantly, cost so much suffering. So for example, if you look at the very bottom, there's 2 studies that were published about 6 years ago. In total, about 40,000 people that were very healthy at the beginning of the study, but they followed them up for about 15 years and identified who during those 15 years had a heart attack, because heart attacks are very common. And they identified a group of people that were almost free of heart attacks in follow-up. And these were the 5 habits in a multivariate analysis statistics that you can do, that anybody can do to avoid a heart attack. Don't smoke, walk every day, eat 5 or more servings of fruits and vegetables every day, which is far more than the average person eats, sadly. I just had a strawberry blueberry smoothie. I think I had 4 servings of fruits and vegetables already this morning. Sleep 7 hours at night. That's interesting. That's nothing we were ever taught in medical school, but people that pride themselves or just can't sleep more than 3 or 4 hours a night, apologize again, are more prone to developing a number of diseases. And unfortunately, a lot of people that have to rotate shifts, like police officers, nurses, doctors in the emergency room, and factory workers that rotate shifts, so their sleep is very messed up, are also at risk. And finally, and surprisingly, I never encourage anybody to drink alcohol, but in these studies, a few drinks a week was preventive, was protective, but that's a small number of drinks. That's not encouraging you to have too big a party tonight.